Hello, my name is Stephen Mcculley. I'm a consultant plastic and reconstructive surgeon with a special interest in breast cancer and breast cancer reconstruction. I'd like to talk to you about implant-based reconstruction. This involves the use of usually silicone breast implants, be they round, or these days more commonly teardrop type shaped implants to help build a breast. The operation is traditionally done as a two-stage operation, although there are more newer techniques which sometimes allow this to be done as a single stage. The traditional technique involves, during your mastectomy operation, a stretching device being placed underneath the skin and the muscle, and then after the operation for the next few months that will be stretched up to re-stretch the mastectomy skin. Following between 3 and 6 months, a permanent silicone implant, dependent on the size and shape that we require, would be swapped for this stretching device, and this would be placed into the pocket to give you the more permanent reconstruction. Now, with the modern implants we can actually create some really pleasing breast reconstruction shapes. It is more difficult to create any natural droop to the breast, but obviously one of the big advantages of implant reconstruction is it does avoid any big scars anywhere else, and it also has relatively short, predictable surgery. The main disadvantage of implant-based reconstruction is that we don't tend to create any natural droop or ptosis to the breast, and therefore it makes it less likely to match your own natural breast on the opposite side as time passes by. Also, although these implants are safe, there are some potential downsides to them, and those include a very small risk of infection around them, but up to about a third of patients over time will develop some problem like hardening around the implant. That is where the body forms a layer of scar tissue which can make the implant feel a bit firm, or they can feel the edge of the implant, or they get some rippling where they can see the implant through the skin. Now, there are some more modern ways, including something called fat injection, that allows us to try and get around that problem to a degree. So in summary, an implant reconstruction is the most common way. It can be very successful in giving some very pleasing reconstruction results. Its main advantage is its relative simplicity and lack of scars elsewhere. Its main disadvantages are that the results tend to be less good over time, and a significant percentage will probably require some revisional surgery to their implant reconstruction throughout their lifetime. Whatever your choices and decisions are with relation to breast reconstruction, I wish you well.